This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, a senior attending here, and I'm joined by our research fellow.
And I'm Dr. Alara. Today, we're looking at a fascinating new study from the Journal of Hospital Infection, published in 2026. It's a multi-center prospective cohort study investigating the association between the duration of neurosurgical craniotomy and the risk of surgical site infection, or SSI.
This is a topic that is always on the mind of a senior attending. We've always had a gut feeling that longer cases lead to more complications, but this study really tries to quantify that dose-response relationship. Ilara, give us the scope of the study. How much data are we looking at?
It's quite robust. This was a multi-center study involving 10 neurosurgical centers in China conducted between October 2019 and March 2023. They followed 4,375 patients who underwent neurosurgical craniotomy. What's important for our residents to note is that they followed these patients for 30 days post-operation using the standard CDC NHSN criteria for SSI.
That's a significant sample size. And in that cohort, what was the actual incidence of SSI?
The overall incidence was 4.5%. That's 198 patients out of the 4,375. But the real story starts when you break that down by how long the surgeon was in the head. For surgeries lasting less than 2 hours, the SSI rate was only 2.1%. But if the surgery went over 5 hours, that rate jumped to 10.1%.
A 5-fold increase once you cross that 5-hour mark. That is a stark climb. Did the researchers find a specific mathematical trend here, or was it just a general increase?
They actually used a Cox proportional hazards regression model to get to the bottom of it. They found a significant dose-response relationship with a p-value for the trend of less than 0.001. Specifically, for every 1 hour increase in the duration of the craniotomy, the adjusted hazard ratio, the AHR for SSI, was 1.34.
So every 60 minutes we stay in the OR, the risk of the patient developing an infection increases by 34%?
Exactly. And they didn't just look at it linearly. They used something called a restricted cubic spline, or RCS, to see if there was a nonlinear association, essentially looking for a turning point.
This is the part our residents should pay attention to. Is there a specific threshold where the risk profile changes?
There is. The study identified 4 hours as the critical turning point. When they compared patients whose surgeries lasted more than 4 hours to those whose surgeries were shorter, the group over 4 hours had a 2.87-fold increased risk of SSI.
That's nearly triple the risk. Now, as we know, longer cases often involve more complex patients. Maybe they are older, have higher BMIs, or the surgeries are emergencies. Did the researchers account for these confounders?
They did. They performed subgroup analyses across various factors: age, gender, BMI, ASA score, surgical priority, and even the incision class. The association between duration and SSI remained consistent across all these groups. It suggests that the duration itself is a primary driver of the risk, regardless of the patient's baseline health.
This really hits home the importance of surgical efficiency. It's not just about getting to the next case. It's about optimizing perioperative infection prevention strategies. If we know a case is approaching that 4-hour mark, perhaps we need to be even more vigilant.
Precisely. The study concludes that quantifying this relationship provides high-level evidence for why we need to streamline our procedures. It's a call to action for surgical teams to consider duration as a modifiable risk factor where possible.
It's a great reminder that in neurosurgery, time isn't just brain, it's also the integrity of the wound. If you can safely shave an hour off a complex tumor resection through better planning or equipment, you're statistically reducing that patient's infection risk by 1/3.
It certainly gives us a clear metric to aim for.
Well, that's all the time we have for today's deep dive. Thank you, Dr. Alara, for breaking down the data.
Thank you, Dr. Aris.
To our listeners, residents and attendings alike, keep an eye on the clock, but keep your hands steady. We'll see you next time on the Neurosurgery Hub podcast.